Welcome to the Fresh and Fired Up podcast. I'm your host, Dr. Emily Marshall, here with my co-host, the wild, wonderful Hailee Piendl. We are here to help you function at your best in health, fitness, and life. So let's get fired up.
Let's get fired up.
Yeah. And we have a special guest on today that I am super pumped to be talking about this postpartum topic, healing your body and your mind and everything that goes with it. So today we are joined by Maria Tyumkin, right?
Got it.
Yes.
Yes.
Okay. I
Nailed
paused
it.
because I was like, I feel so much pressure right now. You can read her last name in the description, and then you can read it out loud and see how you do, just for fun. So I'm glad I got it. But she is a pelvic floor physiotherapist and movement coach. She offers in-home and online support for women in all stages of motherhood with a holistic mind-body approach to healing, which she can fill us in on details with. Maria, from what I have read up on you, you are on a mission to empower women through movement, education, and personalized care, which is just wonderful. We're so happy to have you on today to share about it. And it seems like you deal with lots of different topics that come up, everything from leaking, pain, just not feeling yourself again after birth. So we can dive into all of those topics because we want to help you reconnect with your body without shame, without feeling overwhelmed, and open the conversation about real postpartum healing, not just trying to bounce back as quick as possible. So welcome to the show.
Thank you for having me. I'm very excited to be here and talk about things postpartum.
What got you into this line of work, and kind of specializing in the area that you do?
That's a very good question. I honestly, being in physio school, I didn't think I would be going into the pelvic floor realm or working with women of different ages in that sphere. It started out as an interest working at a hospital where I started noticing people coming in continent and then leaving incontinent. And that just really sparked the mission to manage that and help people navigate the hospital system to minimize the incontinence that was happening there. And so that led me to taking a pelvic floor course earlier on in my physio career. And that opened up the doors to the realm of women's health. I think dealing personally with like stress incontinence from being a athlete, as well as having hormonal irregularities, period issues, that led to me wanting to learn more about my own body. And I've realized there's a lot of misinformation and also us not knowing how our bodies are working and functioning and how we can overdo it to the point that the signals are just not firing as they should. And so that I started seeing with the women that I was working with. So I really wanted to combine that with the pelvic floor world because I don't think it's just the muscles. It's not just about Kegels. It's more of like a whole body approach, which I wasn't really seeing. And so I thought this has to be like a full package deal of what are we dealing with. And so that had led me to working with women of different age groups and then working at a fertility clinic where I see women that are pregnant or postpartum. And then I also see women that are older. So I have an idea in terms of what happens later down in life when menopausal time kicks in. So then I thought, yeah, the gap definitely needs to be breached for all of those women wherever they're at. So meet them where they're at, help them connect to their body. And I call that pelvic floor area as a black box. It does so much for us, but often we're just not in tune with it. And so this is where I'm at now. I've taken a functional medicine course to get a bit of a better idea about like hormones, the nervous system, the gut system. So I continue on unpacking and learning a lot more, but it's been quite a treat to help women navigate the system. I have many women come in. I've been just told to come and see you, but I have all of these things that I didn't even think were related to my pelvic floor. I'm constipated, I'm bloated, I have stress and all of these things. And it's just, okay, let's take it one step at a time and then help women to feel more empowered, and get back into movement, because fear sets in and then the overwhelm doesn't let us get up and move our body the way we want to. And so this is where I kind of bring myself in to help women navigate the system.
Yeah,
Wow.
that's good. Go ahead, Haley.
Yeah, sorry. I was just going to ask you, what kind of clientele do you usually like? Is it predominantly postpartum or like people who want to get pregnant, or is it more so like people, like you said, are constipated? People like get referred to you. What is the dominant clientele that you usually deal with?
hmm That's a good question. So I have a mix of both. I have the women that are coming in, they're pregnant because a midwife and OB, a doctor had told them to go see a pelvic floor physio, or they have looked for social media and thought it's a good idea to go see one. Um, then I get the postpartum population that want to get back into movement, but they're feeling different symptoms that had happened, or they've gone for one pregnancy, everything was fine, going into second pregnancy, and that's where they're feeling some symptoms. So I would say that's a good portion of the population that I work with. And then the other half is women that are in their 30s, 40s, and then 50s, 60s, and beyond, where they have like this mixed combo of either pelvic floor pain, or they have pain with sex, or they have leaking, and combined with the constipation and bloating. Constipation and bloating is very common that I see in most of the women that I work with. There is a lot of stress involved in the lower abdominal area. And then for a majority of those individuals, stress levels are high, overwhelm, anxiety. And so the nervous system is really in that sympathetic state, and it kind of stays there for a while. So then we try to work with them to get them into balance so their body can actually heal on its own.
Mm-hmm.
Yeah. And what is usually the time frame range for that type of healing?
It's a long time frame. Yeah.
Yeah.
So often, if women can start seeing an improvement in a couple of months, that's great. Sometimes we go after low hanging fruit. So, depending where they're at in their journey. So, I have sometimes folks coming in and they're not really ready for that change, or taking in their nervous system into account, especially some of the women that are just very athletic and they're very type A. They'll do all the exercises, but then it's just for them to, you actually need to take a rest day. And it's like, what's a rest day? Can I stretch? Can I do this? And it's like, no, like actually, like read a book, do just like letting your body just relax. And that's tough. So then it's like finding a good balance of like, okay, what can we do that feels realistic for you right now to get you into that phase? And so that's I find is like the challenging component, is helping people actually lower down and take a breather.
Yeah.
Yeah.
I'm so curious too, like your the majority of like your protocols that you do give clients is, I'm assuming, like a little bit of pelvic floor exercises and a lot of the systematic changes where it's like diet, nervous system regulation, stress management, taking those rest days. Would you say that's true? I'm just trying to understand a little bit better of like your approach to, like, because you say pelvic floor, but it's like, well, it's not just your pelvic floor exercises.
It's
Yeah,
holistic.
you're 100% right. I've been switching away from just doing your good old Kegel exercises, because I found they haven't been giving it the effect that we're looking for. So I find pelvic floor exercises very helpful for individuals to connect to that area. Can you contract? Can you release? Can you have an awareness of how that area is working? So usually it's like during pregnancy when the body starts to change, then just for them to build awareness. And then postpartum in the first 6 weeks of like, okay, can we get those muscles firing? Now, because those muscles are working together with the abdominal wall, the back muscles, and the diaphragm, I find if I'm not taking into account those areas and I just strengthen the pelvic floor and I don't bother with the glutes, the abdominals, and the diaphragm, that creates an imbalance. So, finding out where those muscles are at and then coordinating them so they should be moving every time we're breathing because they work together with the diaphragm, getting that pattern going so then the muscles can kick in and do their job. So whether they're, more like lengthened, or are they like more of a shortened position, which is actually more common. They just like sit here because we're not taking those deep breaths. So then the pelvic floor muscles are not moving. And then glutes play a big role. So if we have no less support from the glutes, then often that can lead to more urgency, or the pelvic floors will overcompensate, or vice versa with the abdominal muscles. So that's something that I see is if I see a woman in her 60s and 70s, I will ask, can you roll up? Can you crunch? Nope, many women can't. And often it's due to the changes that happen during pregnancy, the fear mongering of like, you can't crunch, you'll get diastasis. And then people just avoid that positioning altogether. But that is a very important role for those rectus abdominis muscles to bring the rib cage and the pelvis closer together. So then we have a better stacked position, and they also help to pull the pelvic floor muscles up. So I've changed my strategies in a sense of how I do my assessments. I do more assessments with a crunch, with a bridge when they're lying down. Standing assessments have been like game changer. I do it for most of the women that I work with to see how are they functioning against gravity. Because a lot of the time symptoms will happen when they're upright, when they're doing activities. Let's load them up with a weight. Like, can you jump? It may look silly, but it gives us a much better idea how those muscles are working. So then my approach has shifted to being more get the whole system working with like the abdominal muscles, the glutes, see what needs to be released. Let's say pelvic floor wise, then okay, let's do some more breathing so we get that range of motion through that area. Yeah, so that's the part that I really love about my job is like piecing things together and seeing what works for the person. And I always say, if it doesn't work for you, don't worry about it. We'll find something else that will. There's just a plethora of so many exercises that we can do.
Yeah, yeah. And just
So many
curious
ways.
too, like what sorry, Emily, I'll let you ask a question. I just have one more question because I love pelvic floor health.
Yeah,
What
do
are
it.
what are the benefits? So like say someone's like on the fence, oh, I even need to do this pelvic floor health? Like say she's pregnant. What are the benefits of her going through that if like not just like strengthening but like for pregnancy, is there benefits for strengthening your pelvic floor and obviously for after?
Mhm. Yes, absolutely there is. I do have the women that are just like on the fence of like, do I need to do a pelvic floor exam and do an internal? No, we don't. Like even just through the symptoms that you're experiencing, at least we can go through like an awareness piece. Can you squeeze those muscles? Can you release them? What does that feel like? So building that mind connection to that area can be very helpful. And I find for pregnancy, it's like, let's get you moving. Moving the way makes you feel good. If you're into yoga, if you're into walking, if you're into strength training, let's do that. I aim towards strength training, but I totally understand that not everybody is comfortable with lifting weights, but at least like body weight, because I from like what I've looked into the literature is that it really helps with the development of the baby and the placenta, and that helps to build up the endurance for the actual labor itself, and then help people recover afterwards. So that's usually my recommendation. So at least the knowledge of that alone, and debunking different fears about, let's say, doing crunches, or like doing core exercises, or doing weight training, or running or cycling, whatever it may be, both for the pregnancy and the postpartum component. And so that's where I feel like the benefit is going to come in. Plus, going over the breathing and keeping the pelvic floor muscles more open during birthing. So we have gone through like my birth prep has gone for some transformation where I would, talk about like perineal massage and here's some stretches, which I still incorporate, but I find it comes down to, okay, where's your mindset? Can we get you into that mindset to go through labor and delivery? Breathing, and then your muscles will do what they're supposed to do, but having the awareness of how they can open and how you can push so they stay open, that's what I really harp on. Just from feedback, like what was the most helpful thing? It's usually like the breathing and just keeping those muscles open that really help women to go through labor naturally. And then they know, okay, my muscles have lengthened. Now I need to work on squeezing it, or at least try and see how it feels. So that just builds a bit more confidence in the postpartum, especially the first 6 weeks.
Yeah, that's great. Well, and that's a great segue into anything else that you wish more women understood about postpartum healing. And you could, either in the early weeks or months to follow, what are some of the big things that continuously come up with postpartum healing?
Yes, the first 6 weeks are definitely a challenge because it goes from 0 to 100 with a baby, and there's no time for yourself. So I find that's a big challenge. And so during that time, and just looking at the more recent literature, the recommendations are take your rest for the first 6 weeks. Using a binder actually helps with the recovery for the first 6 to 12 weeks. It doesn't weaken the muscles, it just gives women more confidence to move, which then helps with the healing process. So that's my kind of your bare like minimum like recommendations of like rest as much as you can, even if it's like active rest. So let's say baby is napping, have a moment for yourself to lay down and do some breathing. And now I get it, like it's not always possible to do because there's so many other things to do throughout the day. So it's like, okay, can we at least get a like a binder just to give you some abdominal support while the muscles are healing, and then move to the level that feels comfortable for you. With some of the women that are a bit more like keen to get back into movement, then this is where I would suggest once the body feels comfortable for you, can we do some pelvic floor squeezes? Like, now it doesn't have to be 10 repetitions times 3 sets. No, it's just kind of like, can those muscles actually contract? Do you feel that contraction? And then building the abdominal wall again. So with breath work, so breathing in, expanding the abdominal muscles, and then breathing out, really hugging everything in. I find that really helps women to build up the connection, start building up the tone. So by the time I see them at 6 weeks, I'm like, the muscles feel good. They don't feel as squishy. I'm getting nice tone. And then it's easier to build up from there in terms of core exercises and getting them back into the gym. Yeah. Because my thought process is, okay, like sure we're trying to work on the core, but then you're technically doing weightlifting with baby. There's a lot of like holding baby, so your core is going to be engaged, putting baby down, picking baby up, squatting. Like there's just so much movement that happens that I think women don't take that into account as exercise, because we think of gym and like being in that setting that's exercise. So I'm shifting gears here of like, it's okay, you don't have time, you'll be okay, your body is going to adapt. My at least like basics is to build up a bit of that core stack, so then that doesn't lead to muscle imbalance, which can often lead to either low back pain, or sometimes pelvic floor symptoms can come up in the form of leaking or pressure. So we're trying to minimize that.
Yeah, that's good. I love that you brought up some of the more biomechanical stuff, something that I thought of when you were bringing up like that ability to rest. And one of the things is like having your baby against your skin, right? Like, and I don't know, I take for granted sometimes thinking most women know that, but maybe not everyone does, right? And just literally like the more you can have your within that first 6 weeks, those early weeks, the more you can have your baby like right against your chest, it's going to increase your oxytocin levels. The same thing with breastfeeding itself, right? But like even just to rest with your baby on you, that can be so good for your relaxation state. And I'm thinking about what you said about breathing and even laying with your baby on your chest and then doing that intentional breathing, like thinking how good that is for the mental side, the mind part of the healing, the connection with your baby, but then getting yourself in a good headspace for being more aware of the things that you just said, right? How you're breathing, that you're getting movement in as you're moving with your baby. And I think that's so encouraging. So thank you for pointing that out.
Yeah, absolutely. We recently had an in-service for meditation, and the woman had said, if you're doing a meditation for 20 minutes, it's equivalent of 2 hours of sleep. And I thought that that's quite amazing, of doing that active rest of like having the baby on the chest and doing some breathing for 15, 20 minutes. So being sleep deprived, then I'm like, okay, great. So then we're kind of balancing out the recovery and the sleep, which would then help with the milk production, feeling, kind of better and more energized throughout the day. So I feel like showing up, then that helps as well.
That's good.
Yeah. It
Well,
can make you
something one,
feel
sorry,
sorry.
Haley,
Go
something
ahead.
one
Go
of
ahead.
my midwives said to me after it was my first or second. I couldn't believe, like, I remember because women do this thing where they're like, oh, I'm so sorry, my house is a mess. someone comes in and you're like, my house is a mess, and they're like anxious. And the midwife said to me, she's like, I'm so glad your house is a mess, because when I come in and I see women who have just had a baby and their house is perfectly clean, I worry about their psychological state and their connection with baby. Because one, they're going into like overdrive anxiety, and it's manifesting as like, I must clean everything. And they've set their baby down, and their baby's sitting in the corner, and they're not having that connection because they're spending all this time cleaning. I'm saying this not to, if you've been through this, not for any sort of guilt trip, but to realize like this is one of those scenarios where let your house be messy. It's actually better for you and your baby. Anyways, that was just a side note. Go ahead, Hailee.
I forgot what my question was, but like onto your point there, like I feel like that's more of a type A, like Maria, like most of your clientele and like maybe yourself as well. Like I have a very similar story in terms of like cycle irregularities and all of this stuff, but like more of a type A person to kind of care about like status, I guess, rather than that connection with your baby. I also love how you guys just say baby. I think I've been laughing in my head, just being like, you guys are referring to baby as baby.
Yep, yep. Baby's so cute. We love babies.
But yeah, it's more of like a type A person to kind of struggle with that, but I think that's a really good note to just have. Like there's going to be some shifts, and it's a huge life shift, right? So like making space and time and like kind of having that zoom out view of it, just to like surrender to what's going on right now, right?
Yeah. And just to give like testimonial for when you brought up about in like during labor breathing and the like letting go or like the releasing and lengthening of your pelvic floor during labor, that is gold. Like I kid you not, from because I've had four, and I think back to first baby to fourth baby, drastically different. And my fourth labor was the fastest and most, yeah, it just went really, really awesome. And I attribute it to, it was like I finally figured out the breathing, like I like better than my previous three. And I was astounded. I was like, oh wow, this is partly your body kind of knows, it's done it before, but that like breathing into like releasing and opening the pelvic floor is very, very helpful. So especially if this is your, well, it doesn't even matter what number of baby it is for you. If you're listening to this and you're looking for tidbits, right? Uh, get help from Maria, because it will help.
Yeah, that also kind of sparked another question for you, Maria. In terms of like what you've seen in the past, is there a correlation between like the women who can connect to the pelvic floor better and like natural birth versus C-section?
Yes, that is a good question. So I find it gets to a point where the connection helps to know like how to do the breathing for a vaginal delivery. Now, also, I have some women that are having a harder time feeling that. But so we do often for birth prep, we do like an internal, it's kind of like a combo of like a perineal massage with the breath work because I want women to feel that lengthening.
Mhm.
And so if I feel it and I know the breathing strategies that they're doing, then I say, go with the breath. So at least you can do that. Because what if they go with an epidural? So they won't, in some hospitals, they won't be able to feel their vaginal area and their pelvic floor lengthening, but they have a sense of how their breath is working. With then that's the one scenario of a vaginal delivery. With a C-section, yes, it's helpful to have pelvic floor awareness, even if they go through a C-section, because their body has gone through the changes and the pressure has been loaded on the pelvic floor during pregnancy. So biggest contributor to pelvic floor, either like prolapse or the tearing can happen, or pressures in the pelvis with like hemorrhoids or something like that. It's more attributed to pregnancy itself rather than labor and delivery. So with the C-section, then having that awareness is helpful to reconnect to those areas afterwards, because the scar tissue from the incision is going to spread. And sometimes women experience pelvic floor symptoms attributed to that. or the pelvic floor will compensate for the weakness in the abdominal wall. So then they will actually tighten and then symptoms can happen. So I think for both camps, it's very vital to have that awareness. So for me, like number one, it's like build awareness, like build that range of motion so your muscles can do what they're like supposed to do. And then we build a system around it with some glute support, abdominal support, especially for a C-section because of the interruption of the nerves and the cut through the muscles. Women are having a harder time connecting to their lower abdomen. They already have a harder time even with a vaginal delivery, but this just takes it to a little bit to the next level. So with that, it's like that breath and that connection, just like expanding that area really helps for the nerves to start getting re-stimulated. And then core wise, we start getting back into exercises pretty much on par with what I do with a vaginal delivery, with the addition of doing a lot of scar release. I see women in their like 60s and 70s, they've had a C-section and they have scar tissue buildup, or women that have had resections in their the colon and they'll have scar tissue buildup that leads to pelvic floor issues. So I find like scar tissue becomes like so important because it's like spreads and it sits there like spider web. So we want to get it moving. And so in addition to the massage, then exercise really helps to get that tissue nice and supple, getting the blood flow through there. Yeah, that's a great question.
Yeah, that's good. And what do you recommend for I think there's a lot. I didn't have a C-section myself, but I've had friends and clients who have. Is there any other advice you have to speak to some of the mental healing with it too? Because I know I've had friends who can feel sense of disappointment or irritation with this scar, like you brought up scar tissue and like even just the look of the scar and will I be able to wear the bikini I want again and is this blah blah blah. I don't know, there's so many things. So do you have any recommendations that way that is helpful for your clients?
Mm. Yeah, that's you're right. There's definitely that range in terms of where women are at and their how are they feeling about it, and often they will mask it and say, oh yeah, it's fine, and like kind of shove it under the rug. So I do talk about C-sections just to test the waters, even during pregnancy. It's like I know the plan, I know what you want, but there's the potential of something else happening. Like, how are you feeling about it? Can we get the mindset to kind of go with the flow? And if it does happen, then what? You know, so I try to kind of set the stage ahead of time for all of those things that there is fear around. C-sections, tearing, prolapse. Those are like the main ones. And diastasis. Diastasis, there's just like fear, major fear around that as well. So I set the stage initially. And then we go over just what they do nowadays for a C-section. They do quite a great job in terms of keeping the scar very small. They sew it really well that there is no like keloid scarring forming around it. So it's a very thin line. And then over time, that line almost disappears. So many women can't even see it. So that is kind of like my notion to kind of calm the stage a little bit. And then in terms of recovery, there's that, okay, it's going to take me longer to recover. It's like, sure, yes, because we have a surgical like incision through the abdominal wall. However, you've gone through pregnancy, like that's your body is healing from all of that as well. So again, I'm kind of like minimizing the intensity around a C-section, just to help women to be like, okay, if there is a need for it for whatever reason, then it's going to be okay. I'm going to recover. I'll be able to wear the bikini and the clothes that I want. I can build up the abdominal wall the way I want it. So just building up a bit of confidence around that. And so it's the emotional component is where, okay, how much support can I give, or do we need to take more extra support around it? And what is it? Is it the is it like the appearance of it, or is it just like the fact that there wasn't a vaginal delivery? So I feel like that's where like supporting a woman from like an emotional and like a mental perspective then becomes very important.
Yeah, that's good. I like that, setting the stage, that creating expectations, right, that are realistic.
Yes.
That's good. Do you want to do the next question, Hailee?
Okay,
Or do
one
you want me
second.
to do the next question? She's
can do
thinking
it
of a
'cause I'm
question.
like I'm like going with the flow and you got your questions up and I'm like, whoa, what about like C-sections?
Yeah. Well, I was kind of thinking about like along the lines of how postpartum there can be such an emotional roller coaster. Like you said, regardless, your body's gone through pregnancy, it's gone through changes in so many different ways. You have this baby now, right? But also fully dependent on you. Your sleep is low. You're getting used to this new, a period of time where your movement has changed. And I think patience is definitely required, like you already brought up, Maria, in that first 6 weeks. So, what are other things that we can offer help to women with like the identity recovery post birth?
Mhm. Yeah, a great question as well, as I also started incorporating that in my birth prep, postpartum prep of the identity shift, especially for women that are perfectionists, that are like go-getters. Often they have a story and set up expectations for themselves of what postpartum is going to look like. And when they don't achieve it because the bar is set very high, it can feel very crappy. So I do preface that because we're going from 0 to 100 and there's just a new experience of the unknown with how baby is going to be, with lack of sleep, with figuring out feeding, changing, it just changes up the whole routine. So I talk about that and then the identity component. So it's like looking into yourself, what type of personality are you? What do you feel like is going to be triggering for you? What support do you need? So hence I ask those questions like if you're stressed out with work or something comes up unexpectedly, what do you do? Like how do you take care of yourself? And so, what strategies can we implement? Do you have support? Like, is it just going to be your husband? Do you have family support, friend support? What can they do to take the burden off? So, it's like, can they prepare meals for you and just bring that over? Can someone help out with the cleaning? Can your, like partner help out? So then you can go for a coffee, let's say, with a girlfriend for a little bit, or step out outside, or do something that makes you feel good. So then you're not in just the mom identity, and so then you can step out and be all the other beautiful things that that person is, so they don't feel like they're trapped in that particular area. And so I do discuss that so people at least start thinking about it. Additionally, I had a thought, and now it has escaped me, but it will come back to me with regards to the postpartum component. But the main thing is that there will be an identity shift. And so I want people to be prepared for that and see what support do they need during that time so then they can go through it. I offer my support in a sense of like, I can help you with the movement component, pelvic floor, whatever symptoms you have. We can talk about like things that you're feeling as well, because it does come up a lot in those sessions. So even talking it out loud helps the mind to consolidate and kind of figure it out on a subconscious level. Now, I also bring into consideration from a physiological perspective, the mind is really focused on the baby, making sure the baby survives being fed and everything. So it's like an innate component that women have, and then hormones play a big role because they're going through their own roller coaster and things are starting to dip. So that also creates a bit of a change. So I do talk about that. There is that physiological component of you really being fixated on baby. The partners don't have that because they haven't gone through the process of labor, they haven't gone through the hormonal process. So then they can pull you out if you are in that state of really just being fixated or either on the baby or just like everything that you need to do around the house to put in order. So it's like, okay, letting go is the hardest part, I find. So I do talk about that. So then women have a bit of a better plan in terms of what they can do rather than it hits them and they're like, I didn't even know it was going to be a thing. Like no one really talks about it. So whenever I hear stuff like that, I'm like, okay, we gotta bring it up to speed and have more awareness around
Well,
that.
that's really sorry, Haley, do you want to go first? We're both
No,
about to talk at the
you
same
go.
time. We're struggling today with the talking at the same time.
We're so
Sometimes
excited.
we're more fluid than others. It's a day, okay? Thanks for dealing with us, people. You're still here. We love and appreciate you.
Solid.
But just because, Maria, you said, yeah, that whole line in your head of like, oh, I didn't even know this was going to be a thing. And why did no one mention this? Okay, you already brought up the fears around diastasis. Tearing is a big one. You kind of did a list before, right, of like the most common things you think of. And when I went into having like pre babies, having the first baby, those were all the things. Like I was so concerned about tearing and what that was going to mean and what that was going to feel like and all those things. But I did not realize how difficult breastfeeding is. I don't know why this never came up for me, but the first week of breastfeeding, it's not to scare anyone. Breastfeeding is such a beautiful thing, and there is so many things you can do to help with it. But for me, my first baby, it was like the pain and the bleeding with my nipples and the swelling of milk coming in and like the hard firmness in your breast. Like it can be very painful and it can cause a lot of thoracic spine pain. On the flip side, some women, it's like their stress levels are so high with everything that they're not producing milk, or the baby's latch is not correct, or baby has a tongue tie and is not able to latch, or there's so many components with breastfeeding too. And it's one that I'm really passionate about because we have women come into our chiropractic clinic dealing with this, because sometimes, stress levels are so high, and we can do thoracic spine and neck adjustments and kind of hack the system. And actually women's milk will just like come into their breast. Like we've had women like leak through on the table after an adjustment, and they haven't been producing milk because their body just goes like, after they've been adjusted. And so don't undermine like the stress levels that you have play a huge role in your milk production. The pain that can occur in your thoracic spine and your breasts, I feel like it doesn't get talked about enough. So I know it's not exactly, we're talking more pelvic floor, but when we talk about the breathing and the diaphragm and your rib cage and like bucket handle and caliper motion of your ribs, like all of that plays a role in the entire abdomen, which does also affect pelvic floor too, right? So kind of bringing it full circle back to looking at your whole system and creating an expectation for like, this is going to be hard, but it's totally doable. And it's really mostly about getting yourself the right resources, getting the help, having someone inspect your latch, a lactation consultant, getting a chiropractic adjustment, getting the physio or pelvic floor prep, like before you have the baby and then post birth. And you might think, well, how am I going to have time for all this? It's not always like you have to be doing all this stuff 3 times a week for 6 months. Sometimes it's just a couple sessions, like with a lactation consultant. It just might be like 1 or 2 times. And then baby's got the latch and you're good to go and you're rolling, right? And it can make a huge difference. So that was a lot, but thoughts that were coming to mind as you brought that up.
Yeah.
Yes, and I appreciate you bringing that up because I think it's often um, it gets swept under the rug a little bit when it comes to breastfeeding, and women often just like struggle on their own with it. Where I feel like uh, chiropractic care, physiotherapy, the osteo massage could be actually quite beneficial during that time to help to open up the rib cage and open up that whole area, and even like breast massage, let's say, so then there is a better flow and like the nervous system regulation. So you bringing that up, it sparks me to also probe even more with that regard, because it goes back, like it's a whole body approach, which it will affect how the rest of the system is functioning as well. So then giving women like all of those components, and you're right, like the resources. I find it just either it's overwhelming, it's like where do you go, where do you start? And it's like who do you go to, because there's just so many different options. So I find like navigating that can also be very, very overwhelming. So this is where I thought, okay, maybe like in-home online can be helpful, so then you don't feel like you have to leave. It's like we don't always have to do like hands-on, even with you having a bit of understanding. Here's some like easy like exercises or something that you can that can be done throughout your day with something that you are already doing. It doesn't have to be like so structured, but enough to like get you through. Like let's go for it.
Yeah, and you brought up like partners too, right? Like there's in-home stuff that they can, very simple, easy lymphatic drainage massage, right? And that can help with making sure ducts don't get clogged. And it can be a time for you guys to connect too. That's why I love doing these types of episodes, because this serves as a resource if you're not going through this for yourself, but you have friends who are just had a baby or struggling in some way, these are connecting the dot points that be like, sometimes it's just sending one of us a message to be like, hey, I have this going on. What do you think I need? Let's get you to the right person, right?
Yeah, having a support system is huge. And like your partner too, I think it's a really big misconception where it's like it's only the woman going through the pregnancy, whereas like it's also your husband, and like it's this whole kind of song and dance between the both of you. They can kind of be neglected, but like also I guess for perfectionist kind of type A women, we're like, I can do it myself. I don't need help. Blah, 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 blah. But
Yeah.
it's like you can
No.
lean on people, right? Yeah.
Definitely 100% Hailee. That is such a good point. And because it is so good for your baby and like baby and dad to have connection time as well, right? Like it's always a bigger picture that plays a role, because if like your baby is also calm and not neglected and not screaming at the top of baby's lungs all the time, like that affects whole family health. That affects like mood and sleep. And we've had families come into the clinic because we'll adjust baby, like newborn babies too, and it's like the number of times we've had young couples come in and they look awful and hopeless because they haven't slept in like weeks and weeks and weeks because like baby's so colicky and baby just needed like a little adjustment. And then we get these messages that are like, our entire family slept through the night, like you guys are miracle workers. And we're like, well, we're not really, but like it's what do each of you need, right? And it's what you said, it's that song and dance and the dynamic. And yeah, it's actually really beautiful if you can get it all to synchronize, I think, is the
Mhm.
key.
Also, I feel like too that is like the most worth it thing ever, where you go through like such hardship. I feel like this is a really really tough thing for like anyone to go through, and then you guys come out the other side. I feel like the relationship building aspect is like huge.
Oh yeah, it creates so much more strength and connection.
Yeah.
Definitely. Maria, do you have any other like tidbits or things that we haven't touched on just as we're wrapping up, that because we're asking our questions as they come to us, but is there something that you are thinking of that you're like, oh, we really didn't touch on this and it's burning in me, I got to say it now, like this would be a great time to do that?
The component of the partners reconnecting postpartum, it can be definitely very challenging, but also I feel like it can bring people together and see each other in a different light and how they're managing in a situation where they're sleep deprived, dealing with a new challenge, being creative in coming up with strategies, whether it's uh, rocking baby so baby stops crying as an example. And the other component is intimacy and sex. There's this fear of having pain with sex, and sometimes it can feel unexpected having pain after having a C-section. Often it's attributed to the fact that the muscles have gone through changes during pregnancy and scar tissue is pulling on the uteral lining. And so with penetration, it can feel very uncomfortable as if it's the first time, or can be feel very burning due to the increased sensitivities from the nerves that have been lengthened during pregnancy as well. And so that's something that I also open up the floor to, as if you may feel some discomfort. It's not always the case for everybody, but the physiological changes that do happen with the hormonal levels dipping down, especially with estrogen, the collagen level production is reduced. And so there will be more of a sensation of friction and dryness. We have less of that natural lubrication. So we want to stimulate that area, since the nervous system is also responsible for libido, desire. And so stimulating that for women with foreplay, taking time, going through the act of an orgasm and exploring, can be very helpful with the use of lubrication to ease into penetrative sex, both for a vaginal and a C-section delivery. And so I find with that, it's like, creating like no pressure, in a sense of like, when you get back into it, if you feel some pain of discomfort, it's okay. So normalizing that right off the bat, giving it a couple of tries. For most individuals, it goes away on its own, and then it feels good. And if it doesn't, then that's something that we can work on and help to minimize sensitivities, whether it's more so through breathing, or often we do like more manual release to desensitize the nervous system. So that is, I find some women are like, oh, no one talks about that. But then there's this fear of like, I don't want anything near there. I am going to feel pain. And so that story has already heightens the nervous system in that area. So then having a bit of like awareness of it, it's like, okay, you will be fine. So then the nervous system can calm down and actually go through its healing process.
Do you have a time frame like healing recommendation like that? Like there should be X number of weeks before you try to be intimate in that way, or not really? Or is it just different for everyone?
Usually the time frame is at least till the bleeding is done plus 1 week. So for
Okay.
some women, it can be, let's say they're bleeding for 4 and then they're not bleeding for 1 week. So then you could engage in intercourse after that. A lot of the time, women are just like, yeah, no, this is not happening. So most are waiting at least between 6 and 12 weeks, which I feel like gives it a little bit more time to heal. And I have many women that would come in for their 6 week check and then they're like, well, I just wanted to wait and see how things are going down there before I have sex. And then often they're very surprised because we do, kind of feel the tone and they're like, yep, there's no pain. It feels good. And then, so then that helps to lower down the stress around there. So usually I say, and if you continue to notice some spotting, especially if you do some activity, it tells me, okay, the uterus is healing. It's going through its process. So we can just wait a little bit longer.
This has been so helpful, Maria. Thank you so much. This is going to serve as a great resource for so many women, but we need your help. We need you to share the show with a woman that it's going to be helpful for. Make sure that you rate, review, click the subscribe button, YouTube, Apple Podcasts, and Spotify. And in the meantime, be free, feel fresh, and live on fire.